Patients are brought in as coffins are carried out. Across the country, hospitals are being pushed beyond their limits. It's what President Martín Vizcarra had hoped to avoid when he implemented one of the earliest and strictest lockdown measures in Latin America. And the rise of contagion is because of this. Staying at home is out of the question for more than 5 million poor Peruvians who can only live on what they earn each day. And they must go out for fresh food. Nearly half of Peruvians don't have a refrigerator.
We are dying of hunger. Our children have nothing to eat, and the president and mayor don't say anything. They only tell us to follow the rules, but the rules are against us.
In some districts, street vendors scramble daily to avoid police. A curfew added to other restrictions has left more than 2.3 million Peruvians jobless in the capital alone. The desperation is now fueling the contagion.
The great conglomerations in Lima are contributing to an increase of patients, but we must reactivate the economy and help those who need to work in an orderly way.
The pressure is on. Many are already operating with restrictions. The government's push to reopen the economy is leading to more traveling. People will not only have to take the risk of going to the markets, which have been the hotspots for contagion in the city. Now, to go to work, most will have to take a bus, and traveling in them, people are usually crammed up. And healthcare officials say that will likely increase the number of cases, putting an extra burden on the healthcare system.
We are in the battle for Lima. June will be the highest point. More than 65% of all beds are now dedicated to COVID.
When the pandemic began, there were fewer than 150 intensive care beds for Peru's 32 million people. Now the government says there are nearly 5,000, but that may still not be enough. 93-year-old Maximina BOZA was not accepted in any hospital because of her age and because there were not enough beds.
My mother could have died a month ago, but fortunately, a doctor came in the middle of the night to give us medicine.
The healthcare system continues to struggle. Officials say more than 6,500 Peruvians have died. Experts say the real number could be at least twice as much. While patients hope for a hospital bed, poor Peruvians are trying to earn enough to eat, aware that the choice may turn out to be between hunger and getting sick. Mariana Sanchez, Jazeera, Lima, Peru.